Nigeria is making a bold appearance at the 39th Ordinary Session of the Assembly of Heads of State and Government of the African Union in Addis Ababa, Ethiopia, with Vice President Kashim Shettima representing President Bola Tinubu. As one of Africa's leading economy and most populous nation on the continent, Nigeria's presence at the summit underscores its ambition to lead on health, water security and economic integration, all critical pillars for Africa's future. At this high-level meeting attended by ministers of health from across Africa and other stakeholders, the focus is on building Africa's health security sovereignty, and Vice President Kashim Shettima reaffirms Nigeria's readiness to partner with other African nations to build a continent that is capable of healing itself.
Sovereignty in this context does not mean isolation from the world, far from it. It does not mean retreat from global cooperation. It means preparedness anchored in competence. It means the ability to prevent outbreaks where we can, to detect them swiftly when we cannot prevent them, and to respond decisively before a local crisis becomes a continental or global emergency.
Nigeria's Minister of Health, Professor Mohammed Ali Pate, also outlines major reforms that the administration of President Bola Tinubu is undertaking in the health sector, including building the capacity of its health workforce.
Nigeria is committed to leading by example, and by 2027, under the leadership of Mr. President and the Vice President, we declared that we wanted to retrain 120,000 community health workers in the frontline nationwide, integrated with our subnational state health systems. We've already retrained almost 80,000, and we're on a path to get to the 120,000 and more.
Commending Nigeria for its efforts in driving initiatives in the health sector in Africa, the Director General of the Africa Center for Disease Control highlights the trend in the distribution of health workforce across Africa.
Today, Africa is still facing a challenge: 6 million shortage of health workers. If we don't do anything, if we don't stop that, we are facing a major trouble. But we are glad that we are moving.
At the end of the meeting, a communique was presented urging political leaders in Africa to elevate human resources for health and community health workers as strategic pillars of primary health care, universal health coverage, and pandemic prevention, preparedness, and response. The forum also wants progress accelerated toward the continental target of 2 million community health workers by 2030. Emperor Simon, Channels Television News.